So yeah, this is the U.S. Federation of Worker Cooperatives Disability and Accident Insurance webinar. We'll be getting this accident and disability insurance from the Colonial Life Company through our broker, who is Maddie Taterka. And yeah, on this webinar today, we're gonna just do an overview of what our U.S. Federation of Work Co-ops Worker Benefits Program is, which is the program that I run. We're also going to do an overview of short-term disability benefits and the costs involved, as well as accident, and then do a Q&A. We also want to have a little discussion about whether or not our initial plan was to roll out these benefits to begin July 2020, but given the COVID-19 crisis, we just want to know if this is the right time for people, or if a later date when cash flow and just sort of operations are a little bit more stable would be a better time to get the program rolled out to as many folks as possible. So just to sort of ground us in the really important politics of health insurance and our US healthcare system, it's really important to me to think about, okay, why are we offering this disability and accident insurance? We have a broken healthcare system in this country, and in a better world, none of us would have to worry about our income or our expenses if we got sick or injured. We would just be entitled to having our basic needs met because we're human beings. But that's not the world that we live in right now. A sudden disability often means losing income, which can lead to housing or food insecurity, and unexpected accidents, all accidents, can lead to huge medical fees for care and recovery. So while we fight for universal health care for everybody, disability and accident insurance can help provide a safety net in the event that one of us gets sick or injured and yeah, still needs to cover our basic needs. So this disability and accident insurance is going to be part of our overall health benefits program that we have at the USFWC. Currently, we have an active dental and vision insurance program that is open to our members. We also have general health insurance available in some states. And this accident and disability program is new, and we're rolling that out to our members this year. And members can get access through this program to better rates and also better benefits than they would as small individual businesses. When we go in as a group for the Federation, we have a larger pool, which means we can get access to lower rates than sort of one-off groups or individuals, as well as yeah, just more robust benefits with those lower costs. We also offer support with troubleshooting and doing the administrative stuff with benefits, and that's my role. And I work with Matthew and with Mo to help that happen. So yeah, jumping into short-term disability insurance. Short-term disability insurance, this particular plan will provide up to 6 months of a partial income replacement in the event that someone can't work because of an injury or illness that happened outside the workplace or pregnancy and childbirth. The outside the workplace is important because most workplaces will cover illness or injury on the job through workers' compensation insurance. That being said, there is an option that we have to offer on-the-job disability, which is something that you'd work with me and Matthew to make more specifically for your workplace. Currently, we're planning on open enrollment from May 20th to June 25th with benefits that begin on July 1st. Like I said, that timing might shift. And yeah, it's really important to remember that disability impacts all of us, most of us at some point or another, and anyone can be impacted by disability at any time. So this is really something that can benefit any person, regardless of their age or your demographic. So yeah, we have just a couple of scenarios now of just sort of situations where disability insurance could really come in handy. So first we have Tom the bike messenger. Tom is 45 and working as a bike messenger, and he breaks his leg in a car accident that happens outside of work. So Tom can't pedal his bike while his leg is healing. So disability insurance can help cover part of his income to help cover his living expenses while his leg heals. So next we have Jillian, the office worker. Jillian is 23. They work an office job, and out of nowhere, they get this mysterious abdominal pain. They go to the emergency room and it doesn't get diagnosed. And so over 2 months, they go through a diagnostic period where they can't work while they receive diagnosis and a treatment plan that can stabilize their health. After they use up their paid sick time, maybe Jillian is an office worker with a salary that has paid sick time. After that, they can access short-term disability for that longer period of time than the paid sick time. And that allows them to pay for rent and for basic expenses. And then we have Adrian the florist. Adrian was diagnosed with Crohn's and has disability insurance because Crohn's, like many different chronic illnesses, flare on occasion or can progress over time. And so people can be stable at some points and then go through periods where they need more access to treatment or just can't work as much. And so disability insurance can help cover some of those, some of that lost income that otherwise they wouldn't have. Yeah, and so more generally, like I said, anybody can experience disability. It's not something that's just for like a specific group of people, but those who may find disability insurance particularly useful are those who have chronic conditions that like may eventually impact ability to work, even if they don't right in this moment, or those whose jobs would be really impacted by an injury or an illness. So someone whose job might involve more manual labor. This particular disability plan also will cover people who are pregnant and having children through childbirth. And so it can be really good for people who may become or are planning to become pregnant, particularly if your workplace doesn't or can't offer paid parental leave. And yeah, just to reiterate, this is not exhaustive. And yeah, I just want to acknowledge that like there may be lots of scenarios that I haven't thought of where someone might find this really useful. Yeah, so the costs and the benefits, who pays for disability insurance. This particular plan that we're offering is something that people get access to through their workplace, but individuals pay for on their own out of their paychecks after taxes, or out of their pockets after taxes. And the disability benefit costs vary from state to state, but the cost is generally between $2 and $5 for every $100 of benefits you would receive. So I know that's like a little bit, it's a lot to wrap your mind around maybe, but I have a couple of scenarios coming up that I'll break that down a little bit more. So with this plan, you can receive up to 60% of your typical income as your disability benefit, and that's not taxable. So the 60% is sort of meant to closely mirror the take-home pay that you would have after taxes. So going back to Jillian, let's say Jillian has a salary where they're making $45K a year. So before taxes, that's about $3,750 a month. So that means that Jillian can sign up for about 60% of their income in disability payments. So as a 23-year-old, they have to pay $214 a month per $100 that they will receive in that benefit. So they're dividing $2,200 divided by 100 and multiplying it by 214. So that's $47.08 a month. And that's when we have our sign up, we'll sort of have this broken down really extensively so people can easily figure out what it is that they need for their benefit. Next, we have Tom in California. Tom, being a wage worker, is taking what disability benefit he gets by an average amount of hours that he's working. So let's say Tom works on average 47 hours a week. That's about $1,620 a month before taxes. So about $1,000 is the amount of disability benefits that he's eligible for. And doing that same math comes out to about $2,770 a month. I know that's a lot of math to just be talked at, but hopefully this gives some sense of what the kind of monthly costs would be. So yeah, moving into the specific circumstances of our open enrollment period that's coming up. So it's actually very important that we have people signing up for disability insurance who might want it, that they sign up during the open enrollment period. And that's because oftentimes disability insurance companies can deny people coverage because of their pre-existing conditions, or can exclude disability leave needed because of pre-existing conditions. And pre-existing conditions are medical conditions people had before they signed up for the insurance. And this isn't an issue with medical insurance because of the Affordable Care Act, but is still very much a factor with other types of insurance like this. But the exciting thing is that for the 2020 open enrollment period, and only for that, that nobody can be disqualified and no condition can be disqualified. So that's called the coverage being guaranteed issue. So if you sign up after the 2020 enrollment period, people can be denied coverage for certain conditions, or they might be excluded. And yeah, so the other thing that's important to know is that the benefit is portable, which means you can keep it even if you change jobs. So this in particular might be useful for someone who's thinking like that they need a disability benefit for a chronic condition, but are sort of like, well, I'm pretty stable right now, but I don't know about the future. You can take this benefit and the cost of the benefit with you if you change jobs. So this is to get a little bit more into the guaranteed issue timeline. I just want to like break this down because the timing is really, really important. So this timing, the dates here could change if we decide to move the timeline because of COVID-19 and people's and just sort of the general upheaval of this moment. But the overall timeline would stay the same, which is that for 2020, the open enrollment happens. And if you sign up during this period, any disability that originated before then will receive coverage with a caveat of eventually. So if you sign up before July 1st, the coverage beginning date, after that, any disability that comes up that's new will be covered immediately. Any disability that you already had would be covered after a year of having the benefit. So going to the example of Adrian, who had Crohn's disease, Adrian wouldn't be able to receive coverage for disability leave related to Crohn's until a year after the benefit began, which is another reason why the portable nature of these benefits is really important. It might make a lot of sense for Adrian to lock in this disability coverage now, so in the future, if they need it, 5 years ahead, however long, they'll have it. and that income, their income can be protected, and they'll be able to not worry about at least like a base level of income. Yeah. So that's disability insurance. We're gonna have Q&A at the end of the presentation, and I see some questions coming in over the chat, which is great too. We're gonna talk about accident insurance now, which thankfully is simpler than disability insurance, at least in my head it is. So accident insurance offers fixed one-time payments that are meant to help cover out-of-pocket costs related to experiencing an accident. So I get hit by a car crossing the street, I will get coverage for various things related to getting hit by a car crossing the street. And it's just sort of, the accident happens, you get various payments related to that, and we'll get into that next. Covering things like ambulance costs, hospital copays, treatments, and it's meant to really supplement medical insurance. The kinds of payouts are things like, they're in amounts that can like cover or help cover an insurance copay, or cover or help cover costs related to someone coming to stay with you while you're recuperating, something like that. It can also provide a stopgap for people who are ineligible for general health insurance for whatever reason. It's not ideal, it's not a replacement for health insurance, but if you have access to this and you don't have access to health insurance, it might be better than nothing. And this, unlike with disability, it applies to accidents that happen at work or outside of work. So another cost scenario, we're gonna come back to Tom with his broken leg. So Tom broke his leg in a car accident. His child is also with him, and it turns out that he and his child both had accident insurance, which he got through his plan with the US Federation. Tom in California pays $37.19 a month for accident coverage for him and for his child. And because of that, he got these following payouts that are listed on the right here. On the right. So the accident insurance pays a flat payment, $250 each for each ambulance cost, emergency room care, $125 each, x-ray, an amount paid out just because he has a broken leg, and then payouts for crutches, physical therapy, follow-up doctor's visits. The thing about accident insurance is that these are payments that you can designate to sort of whatever you need. Like, you're getting paid these amounts, but you don't have to, like, you can use them for what you need for those costs related to the accident. So all in all, for this broken leg accident, Tom would end up getting about $2,670 in coverage. And yeah, obviously insurance company caveats always apply, but that is the plan's structure. So that's sort of just the basic overview of accident insurance. For both of these plans, people can sign up if their organization is a member of the Federation. If the organization signs up for benefit access and pays a $50 annual fee, that's all it costs to the organization. And for people who are working an average of at least 20 hours a week. And this is just a sort of overview of the two benefits side by side, comparing the different facets of them. All right. Yeah, are there questions at this time? I see some good questions in the chat that I might Just start with, we have from Key Figures. Welcome, Key Figures, to the webinar. Is the coverage guaranteed issue during any open enrollment period, or is it just that it's for this open enrollment period? That's a really good question and really important. It's just for this first open enrollment period, which sort of takes us into, I want to open it to other questions, but that also gets at this question of asking, like, is this the time to do it? If there's going to be a significant number of co-ops or people who just can't access this because of current cash flow and general upheaval over COVID-19. Yeah, are there any other questions? Another question from Key Figures, just always good to reiterate that this benefit would be for up to 6 months, with what's a 2-week sort of waiting period for the benefit to begin.
Can I ask a question, Maddie?
Yeah.
About the, so you said for the accident insurance, with the, you get, so they assign an amount of money to each type of cost, but you get the lump sum and then can decide how to effectively apply that to your costs, right?
Yes, yeah. I'm also seeing a question, do we need any minimum participation from our staff in order to access this program, or are we good if at least one person signs up? There's no minimum participation, so if one person wants it, you're good to go. Question, are there provisions for mental health disability? Matthew, can you speak to that, to what extent mental health is covered or not?
Hi, can you hear me?
Yeah.
Hello?
Yeah,
it is covered. Yeah, it is covered. Usually disability doesn't cover it, but with this policy, it is covered. To the extent, like what's covered exactly, to what degree, it goes to that ambiguous phrase, medically necessary. So it really, I guess when the rubber hits the road, my guess is that your doctor's going to need to kind of go to bat for you a little bit and, prove that it's medically necessary in their opinion or in some way, right? So basically, if you have enough medical proof, evidence, documentation, enough of a, let's just say a legal argument that this mental disability or whatever you want to call it, will lead it so that you cannot work. And so that's kind of the threshold you have to meet. But yes, it is covered. Typically, most disability policies, it's just a flat no. Here, it's yes on paper, but when the rubber hits the road, we'll see how it works.
Cool.
Does that help at all?
Yeah. Yeah, that's really helpful. So it is included, but there may be a certain amount of advocacy to get the coverage acted on. Yeah. Okay, we have another question. What happens if I lose my job and don't get another job soon? Would my cooperative transfer the cost of insurance to me as an individual? So you can, Matthew, correct me if I'm wrong, but the portable nature of the benefit means that you have access to the amount that you're paying for as long as you're paying for it.
Yeah, I think the way that, we can wheel back around to this, but you would be paying for it individually from day one, the way I think we're trying to administer this. So in terms of the question, what if I lose my job? There would be no transfer that needs to take place. So no such transfer would ever need to happen because you would be paying for the disability benefits from your bank account directly from day one.
Great. Yeah. Yeah, so this particular disability plan is for individuals to pay, but to access by being a worker at a certain workplace. We have another question. Do you expect to also be offering long-term disability in the future? We don't have a plan for that right now. If it becomes something that our members want, it's always something we can look into. That is the nice thing about this program, is that we're just trying to find out what is of most use for our members so that we can figure out how to get access to it for as many of us as we can. Are there other questions or thoughts? Oh, another question. Coverage limits are per incident. Yes, coverage limits are per incident. One could use the short-term disability for multiple disabilities over time. Yes. Or disability and a pregnancy, or any sort of combination. Yeah, it's not a one and done deal. These are really good questions. Keep them coming.
Hey, this is Mo. I just thought I'd chime in here. So Maddie is our amazing staff person who's able to, facilitate the program now, because we've grown it over the course of the several years with dental and vision insurance. So this is us expanding our offerings. And I think one thing that we've learned over the last couple of years is that the really important thing, the thing that we center, is the work. So, like Matthew said, there's going to be moments where we have to go to bat for you with the insurance companies, because none of us are particularly happy with the structure of how insurance and medical coverage works in this country. But the really important thing is, in the role that we see as our role as the U.S. Federation of Worker Co-ops, is doing the work of going to bat for you. So Matthew has done this many, many times for us in other situations, and I like to navigate what is the best possible situation and the most amount of coverage that we can connect people to. So I think there is always, of course, some level of caution. We can't guarantee things, but at the end of the day, I think the real benefit of this insurance plan is that you have Maddie to call and you have Matthew to call when their questions come up. And I trust both of them, and I think it's really important that we, as a worker co-op community, look for all the different ways that we can support each other and just navigating some of the questions, right? Because I think a lot of times it's about how you phrase what your issue is, rather than whether I can get covered. So there's a lot of intricacies to how people get billed for insurance, and it's important to make sure that you're using us as a resource to navigate those issues. So I just wanted to lift up the really great work that both Maddie and Matthew are already doing to help us navigate, including putting webinars like this together.
Cool, thanks, Mo. Yeah, I'm really happy to be in this role and to be able to answer all your questions, and yeah, to just be trying to expand this more. We've got some more questions that are coming in. Will we be signing folks up through our workplace and submitting the paperwork through an administrative function, or would we just be sharing information with our staff and allowing them to sign up on their own? I think it would be mostly the latter, of people having access to the information and signing up on their own for their personal needs. And I think also, though, we would definitely want and rely on different workplaces to help with sharing information and making sure people understand what the benefit is and how to access that sign-up information. Another question, does the $50 fee apply to accessing dental insurance as well? Dental insurance and vision insurance operate a little bit differently because unlike these benefits, there is a portion of that cost that the workplace pays for, and payments come from the workplace directly and not individuals. So for the dental and vision program, we actually have a monthly administrative fee that is less than $50, except for the really big co-ops, and closer to between $10 and $20 a month. And there's just a lot more sort of logistics to that we can get into offline if you're interested. Always happy to talk about dental insurance. Yeah. Then when, how will information be available, read specific monthly fees? The rates are always finalized. I think it's 3 months before, but we're currently working on, me and Matthew together are working on the best way to present that information. And so that'll roll out over probably the next month. Thank you for these excellent questions. I guess, so our question for the worker co-ops on the call, or the members on the call, is that, like, you know, we want to make sure that the most people and the people who need it most have access to this, to these benefits. And so I would also love to hear some thoughts about whether or not the timing of rolling out this benefit for July 1st makes sense, given everybody, like, given cash flow, and also just given that I know, like, right now is sort of a logistical and administrative nightmare for worker co-ops that are working on different kinds of, like, ways to weather the COVID-19 economic storm. And the $50 fee would be, I believe, for each, though we might roll out, we might have a discount if you do both.
I can answer that question if that's helpful.
That would be great.
On behalf of Key Figures.
Cool, thanks, welcome. Also, if you want to just introduce, like, your name and your pronoun and your role, that'd be great.
Andy Shively, she, her. Sorry, sometimes I end up logging in under our, like, conference account, and sometimes it's my own account. So it should say my name instead of Key Figures.
Oh, yeah.
So the timeline does not, the answer I can give you today is that the timeline does not pose any barrier for us.
Mm-hmm.
However, whether or not we participate will absolutely depend on the interest amongst our staff. So if everybody's like, I'm freaking out about money and I'm not going to pay for anything, then we're probably not going to sign up. But if folks are like, I very much want insurance because the world is uncertain, then we're going to sign up. This is not currently in my budget. It's a small adjustment. I'd need to get that approved by the board. So just having some time to do that kind of stuff. But we're just still assessing the financial impacts on our business. As of right now, I think we're okay. But I could have a very different answer for you in 2 weeks. So
okay. That's great. Thank you so much. Does anyone else have a thought? This is it. We aren't, like, taking a vote or anything. We're just doing, like, a temperature check. So would really love to hear other thoughts, but also, like, no pressure if you don't feel like you can speak for whoever it is you might be speaking for.
It might just be an individual thing, like just having this information is really helpful, but just knowing like, okay, this is how much it's going to cost me per month to enroll in this, and being able to look at those numbers. So I'm not really sure how our team will respond. This is Elizabeth from Sassafras.
Great, thank you, Elizabeth.
I'll just skip that. Sorry.
No, go ahead, please.
I was just putting a check mark next to Elizabeth's comment.
I actually don't have much. We were in the planning and financial projection phase now, and I'm mostly assigned to investigating benefits packages. And so this is really helpful to know. And we won't have members eligible to use this for probably another year. So yeah, we're definitely a target market, but we wouldn't be able to sign up in this open enrollment period, which is really too bad.
Cool. Yeah. And I guess I don't know I guess Jay, I don't know if your co-op is a member of the Federation, but one thing that is important to know, just sort of overall, is that the open enrollment guaranteed issue will be available for new members of the Federation. So like if people are signing up as a member of the Federation, they will have sort of a grace period to get access to that guaranteed issue.
Oh, that's wonderful to know. Great. Thank you.
Yeah, thanks for bringing that up too. I think, well, Matt, can you weigh in on if it would be available to new employees of a co-op that was already enrolled?
Yeah, it would be available to new employees at the original guaranteed issue that's being presented at the open enrollment currently.
Great. So basically it has to be, you have to sign up for it whenever it first becomes available to you, whether it's a new co-op or a new employee of a co-op. But current members of the Federation can't just be like, well, we'll see next year. Yeah, is there any other questions or thoughts?
Quick question about in terms of the open enrollment period for either like new members joining the network or for new employees of a co-op that's already on it, like do they also get that pre-existing conditions extended to them or no?
Yeah, so the guaranteed issue, which means that any pre-existing conditions would be covered, that's available for either new members of the Federation or new employees of an organization that's already signed up.
Thank you.
I know it's sort of a lot of different layers. It took me a while to wrap my head around it.
I have one more question if
Great, yeah.
that is okay. And you might have covered this. I apologize for being late. Are you planning to put out materials kind of explaining all of this that we can share with our staff once the kind of estimated fees are out? Okay, so I don't need to like a bunch of memos. You'll just send me stuff and I can send it out.
Yeah, we're working on some one-pagers. We're all sort of behind on this because of our own COVID response stuff, but yeah, there will be more of this available. A lot of this information is on our website at usworker.coop/health. But we'll also be putting together some one-pagers so it can be more easily shared with staff and workers. Cool. So we have until 2. We don't need to talk till 2, but if anyone has any other questions, yeah, chime in. Cool. All right. Well, I'm gonna take that as everyone understands disability and accident perfectly. Just kidding. But yeah, thank you all so much for being here. You can always reach out to me at benefits@usworker.coop. I didn't put that in the PowerPoint, but I will put it here. I answer that email. I'm on it all the time. Yeah, so I'm really happy to answer more questions about this or about our dental and vision programs as well. Open enrollment for that is in the fall on a annual year cycle. And yeah, just hoping that everyone is well and healthy and managing the chaos as well as they can. And yeah, thank you so much. Everybody take care.
Thank you, Maddie.
Okay, bye-bye.
Bye. Thanks, Matt.
Thank you, Maddie.